Malaria continues to be a major public health concern in Nigeria, causing huge economic losses annually to households and governments.
Kogi State has come a long way in its efforts to curb the burden of malaria since 2016. Malaria is one of the most severe global public health problems worldwide, particularly in Africa, where Nigeria has the highest number of malaria cases with approximately 51 million cases and 207,000 deaths reported annually. Approximately 31% of the total malaria burden in Africa, while 97% of the total population, approximately 173 million, is at risk of infection.
Malaria is an infectious disease. It affects everybody, from children to adults, everybody. And we know that, particularly in Nigeria and in Africa, there's high incidence of malaria because of our environment, tropical region, high racism, and a high level of mosquito that breeds and transmit the disease.
Over the last 5 years of the New Direction administration of His Excellency Governor Yahaya Bello, there have been programs and practical efforts to reduce the burden of malaria in Kogi State as captured in the New Direction blueprint.
It's no longer news that the Kogi State government, under the people-oriented leadership of His Excellency Governor Yahaya Bello, prioritizes health and the well-being of good people of Kogi State. Hence, there have been deliberate and concerted efforts to tackle malaria and reduce its incidence. His Excellency, as a leader who was prepared for leadership, launched the New Direction blueprint at inception of his administration in 2016, stating clearly the intention to reduce the burden of malaria by at least 75% before the end of his administration. In the first term of his administration, we distributed 2.1 million long-lasting insecticidal nets at the rate of 2 persons per net in order to reduce the burden of malaria before 2023. This was followed by net replacement campaigns biannually under the maternal, newborn, and child health program.
It is not just saying something for the sake of praising. Of course, you see, the effort of His Excellency Governor Yahaya Bello in the health sector cannot be underestimated.
Early and accurate diagnosis of malaria, followed by prompt treatment, reduces the risk of severe diseases in malaria endemic areas. Based on this, the Governor Yahaya Bello administration, through the State Ministry of Health, in its drive to reduce the burden of malaria and facilitate treatment, procured and distributed rapid diagnostic test kits, RDTs, for malaria to state health facilities. This has further helped to improve malaria diagnosis as well as timely referral for specialist attention in secondary and tertiary facilities. While the Kogi State government, through the Kogi State Ministry of Health, is presently working to strengthen the state malaria elimination program, the state attracted partnership with Malaria Consortium, leading implementers of seasonal malaria chemo prevention globally. Recently, Malaria Consortium has implemented seasonal malaria chemo prevention in 5 cycles in Kogi State with remarkable successes.
The government of Kogi State has introduced seasonal malaria chemo prevention, SMC. In this second term, Kogi State's Ministry of Health has partnered with Malaria Consortium, a leading implementer of seasonal malaria chemo prevention globally. Because of the successes recorded so far with some northern states in Nigeria, this strategy has now been introduced to Kogi State. This is a plus to the commendable health strides of the present administration in Kogi State. Our intention is to target over 400,000 children aged 3 to 59 months in Kogi State. This program is presently being implemented in 9 carefully selected local government areas in Kogi State, and they include Lokoja, Kogi, Ajakuta, Okehi, Adabi, Omala, Basa, Yagba East, and Yagba West local government areas. Other local government areas are to be covered in subsequent phases of the program.
We come with sanitizer. We taught them how to prevent COVID-19. After then, we now call them, we call the parent, and we taught them how to use the drug. After we have tested it in their presence, that is when we give to them. Then we give the children. Then after we have done that, we call on one of the mother. Then we give them like 2 spoons of water. We put it on the cup and put the drugs, and we told them not to allow their hand to touch the drug. So when we press it and put it inside, then before 1 second or 2 to 3 seconds, the thing will dissolve. After dissolving, before we give to them. And most of them appreciate what we are doing to them, and they appreciate the government about the program. Excellency Alhaji Adoza Yaya Bello, honestly speaking, we thank him for giving us this opportunity, for using this anti-malaria for our children. Since when this anti-malaria, from what we are giving to them, this thing never happened. They never know anything about or malaria, any effects again.
Since they be giving those children malaria drugs, and you see that the thing is working well. The malaria is far from those children since they started taking it. It's free, we didn't pay. Thank the government of Kogi that brought the program that assisting children in Kogi.
It is expected that at the end of the implementation of seasonal malaria chemo prevention (SMC) mass drug distribution in Kogi State, the level of malaria cases in children aged 3 to 59 months in the 9 selected local government areas will be reduced drastically by at least 75%, if not completely eliminated from all the selected local government areas.